Hello, this is Chapter 12 lecture video part 1. Chapter 12 is Gender, Sexual, and Sexual Orientation Differences. What you can expect to get out of this chapter and out of this lecture video is we are going to discuss the differences between gender in relation to addiction, as well as focus on some things that are important to know about sexual orientation and how it can affect addiction or how addiction can affect a person. So the first part of this lecture video will talk about gender differences, and then the second half will talk about sexual orientation differences. I would like to start with a quote that is in your textbook on page 473. We need to let go of our damaging, prejudicial, unjust, outdated images and ideas about drug users, particularly women drug users, who represent a heterogeneous, not a homogeneous group, in order to construct new insights and theories about their drug-using gendered experiences, by Elizabeth Ettori, 2015. So that quote kind of hits for me. When I've worked in the field, I would have people kind of illustrate, what does an addict look like? What does this look like? What does that look like? So I'm asking you guys to think about, what is your image of female drug users, or what is your image of drug users in general, whether it be female or it be male? This is one of your discussion questions, so you'll actually have a chance to kind of express these opinions or these thoughts. So please definitely take a look at that discussion board question and kind of think about that quote that I just read, and you can reference it on page 473, and I believe I do have it on the discussion board question as well. So moving on with gender. Gender is socially constructed. Our gendered behaviors are taught and reinforced by others. We can't do gender all by ourselves. Think about yourself, think about stereotypes that you've heard about males and stereotypes you've heard about females. Is that socially constructed? Gender is hierarchical, with males having more power. Historically, substance abuse treatment and research have focused on males and not females. This did change since the 1980s. So what sparked the start of drug and alcohol services for women? In 1984, there was a federal requirement that 5% of each block grant to the states be targeted to women. 4 years later, the war on drugs and the national press obsession with crack babies helped inspire Congress to double the target programs for pregnant women and women with dependent children. Another thing that kind of sparked, the start of the services is in 1993, it was mandated that more women be included in clinical trials so the gender differences could be studied, because there wasn't a lot of research out there for it. 2001, SAMHSA published a provider's introduction for substance abuse treatment for lesbians, gay, bisexual, and transgender individuals. And then lastly, in 2004, the Center for Substance Abuse Treatment and Center for Mental Health Services began funding services for women. So what was the result of all this? We're giving women more services and a treatment improvement protocol for addressing the specific needs of women, because let's face it, not all women have the same needs. So this is allowing for more services for women, and it can be different than working with males. Gender identity and sexual orientation are rarely reported in the substance abuse literature. So we don't have a lot of research to go off of at this point. And there are a few programs with gender-sensitive approaches to substance abuse treatment. Outcomes of these specialized programs are generally favorable if they're present, but there is a consensus yet that targeted treatment for gays is better than combined when you have gay and straight people together in the same treatment. Research in this area is focusing on gender differences in biology, genetics, paths to dependence, responses to various treatments, relapse, and social context. The research, however, has no definitive conclusions about whether women-only programs are better, but a lot more research needs to be done. Again, when we have that lack of research, we're not really able to kind of improve on things because we don't really have anything to go off of. So maybe if we were able to start researching more, we'd be able to have more insight to make changes and improve treatment altogether. When we look at gender, not all people who identify with a specific gender are alike. Things to keep in mind: we have social differences, class differences, cultural differences, psychological, neurobiological, age, and ethnicity all play factors in, differences. Across the globe, men actually drink more heavily than women. There's a significant ratio to that. In the United States, males are more likely to report drug use than females, twice as likely to use marijuana than females, and twice as likely to use cocaine. Males are also more likely to use tobacco than females, and the binge drinking rate was almost twice as high for females. So females are more likely to binge drink. However, there is an exception to this for teens 12 to 17. Similar rates of substance use and dependence were around 5%, same kind of difference for tobacco and alcohol use and binge drinking as well. When we talk about entry into treatment of those who use, men, regardless of their age or cultural background, are less likely than females to seek treatment and more likely to leave treatment early. So females hold the higher ratio in entering treatment and sustaining treatment. However, more men than women are in treatment, which is interesting. We don't really know what the difference of that is due to, but more men are using. Who smokes more in the United States, men or women? Men, by 31% of adult men versus 20% of women smoke. Who is stigmatized more for alcohol or drug use? Females. Females are stigmatized more for drug use. For various different reasons. They're looked at as like that mother figure and they're taking care of the home. So unfortunately, they're more stigmatized than men. They have less privileges or power because they are female. More women than men are poor. Many are paid less than men. Lower rates of employment. Child caring hinders employment. And education. They may not have a high education. There's cultural stereotypes. More likely to be hurt or killed in close relationships with domestic violence. And then add in the attitudes toward them being alcoholic or drug addicted. How does that affect their getting help? I mean, let's see. Women seeking treatment have even less money and more reliant on welfare. They have less skilled jobs, less support from family or from a partner. They have children, more so, and role expectations. Women tend to be shamed because of their gender roles as mothers and caretakers. If they drink, then they can't take care of other people. They're failing in these roles, which leads to shame and substance use. So when they're shamed because they are using, but they're using to deal with the shame. Men can feel shame for not being self-sufficient as well due to their gender roles to support their families. Gender expectations of men are that they're fearless, strong, powerful, dominant. Falling short of these demands results in stress and shame, which is leading to more substance use. Talking about partner relationships, women who are substance dependent are more likely than males to have a substance dependent spouse or partner. Some think it's the biggest factor in women's addiction because maybe they're codependent on their partner and it kind of, enables that addiction. When they enter treatment, they are less likely to complete. And if their male partner is using, I got it all twisted there. All right, so when they enter treatment, they are less likely to complete it if their male partner is using drugs. There we go. And if they try to stop, their partner may prevent them from stopping. In contrast, men say that they are influenced positively by a partner to enter treatment or enter because they are involved with the criminal justice system. So that's different. Men are more likely to be positively influenced versus women who are more likely to drop out. And also, if the man is in a relationship or has children, he's more likely to complete treatment. If he completes, he's less likely to relapse and more likely to stay with his partner after treatment. In fact, more likely than a woman would be. So can anything be done about that problem? There's a program out there, a study in 2011 for heroin-dependent male partners of female pregnant partners who were in a methadone program, and the males had no interest in treatment. It included detox or methadone, 6 sessions of motivational counseling program, couples counseling, and men's psychoeducation support group. It was a small study. There were positive results from the study, however. It increased treatment retention over the control group, and it increased social support for their partners, and it decreased the heroin use. So that is what we get when we look at partner relationships in regards to addiction. Let's take a moment to talk about parenting. So how is parenting affected by addiction? Most women who enter substance use treatment are mothers, which is interesting. Some barriers to entering treatment and staying in treatment for women particularly is child rearing, lack of treatment designed for women who are pregnant or parents, and the needs for women, lack of childcare, lack of transportation, we've heard those ones before, and fear of losing kids if they seek help. So treatment is kind of looked at as a threat. So these are not issues for most men. Could they be issues for men? Absolutely, but more so for women than anything. We tend to blame women for moral failure rather than looking at systematic issues of poverty, lack of supportive services, and lack of gender-sensitive treatment. And mothers can lose custody of their kids due to drug use. That's a very big thing that is occurring. 47 states include some form of drug use as possible child abuse and neglect. So, in 18 states, if a baby is born to a drug-addicted mother, they can lose custody. In 12 states, exposure to drugs before birth is the definition of child abuse and neglect. Specifically related to Pennsylvania, a healthcare provider shall immediately make a report or cause a report to be made to the appropriate county agency if the provider is involved in the delivery or care of a child under 1 year of age who is born and identified as being affected by any of the following: illegal substance abuse by the child's mother, withdrawal symptoms resulting from prenatal drug exposure, or fetal alcohol spectrum disorder. So, the county agency shall perform a safety assessment or risk assessment or both for the child and determine whether child protective services or general protective services are warranted. So that's just in Pennsylvania, but there are other states that follow the same suit. At least half of women in substance abuse treatment programs have been involved with child protective services. I mean, if they test positive for this while they're giving birth, child protective services is getting involved. More than half of children in out-of-home care have families with active drug and alcohol problems. Recently, residential programs for pregnant and parenting mothers have been developed. There's approximately 19 states for that. And 12 give pregnant women priority access to treatment slots. So that's, they're trying to work to improve that. And there is convincing effectiveness on the data, according to your textbook. Single parent males could also use such services that, though there are probably none or very few for just single males. Talking a little bit about crime and punishment in regards to gender differences, men are more prevalent in the criminal justice system. Their offenses tend to be more violent, 54% for males versus 37% for females in state prisons for violent offenses. Drug offenses, women have more, 59% versus 50% for men in federal prisons. The number of women is increasing because of mandatory sentencing for drug offenses. And, with that increasing, we're going to have more women in prison for mandatory sentencing. 80% of female offenders have a substance use problem, and 50% are using substances when they commit the offense. So maybe they are more inclined to commit their offenses if they are under the influence of drugs or alcohol. Who do you think would be more likely to be the victims of violent crime, men or women? And interestingly enough, that is just about even. Males maybe slightly more than females, and men tend to be the perpetrators. Both are more likely for those who are under the influence of alcohol or drugs. But an interesting fact is that there is something stronger than alcohol abuse that predicts family violence, and it's a cultural approval of violence. Who knew that there was such thing as a cultural approval of violence? We have advertisements against women being tied up, lower status of women in employment and pay. Women are at risk from most of the people that she loves. These are some of the cultural views towards women that kind of be put out there that women, should be affected by violence or should be traumatized by violence. There is trauma for men and women. For men, trauma is more often involvement in a serious accident or witnessing someone being injured or killed. For women, it tends to be rape or sexual assault. The more severe the violence, the stronger the likelihood of high-risk sexual behavior, substance abuse, suicide attempts, having more sexual partners, trading sex for food, drugs, etc. Any kind of trauma increases the likelihood of substance use disorders. Just a couple other, facts of information. Males have slightly more co-occurring disorders than women. For women, co-occurring disorders are associated with physical or sexual abuse. They're separation from their children, or incarceration. Men and women smoke cigarettes for different psychological reasons. Men for boredom, fatigue, and concentration. And for women, it's to decrease stress and anger. Women have more difficulty stopping smoking than men, and they're more sensitive to weight gain after they quit smoking. Women don't do well with confrontation treatment models either. A little bit about biological differences by gender. 2005, Alcohol and Drug Services studied by SAMHSA say that women move from alcohol use to treatment quicker. They have more medical consequences, become intoxicated quicker, and women have more physical problems related to alcohol use. Women metabolize nicotine faster than men. Alcohol has negative impact on sexual functions in both sexes. Smoking impacts reproduction in women, and 18% of pregnant women used alcohol in the last month, according to SAMHSA in a 2013 study. So there are definitely a lot of differences as far as gender. Men may have higher rates of one thing, women may have higher rates of another thing, but there's definitely gender differences to take into consideration. Regardless of what gender a person identifies with, addiction is still an issue, but we still want to point out some of these gender differences so that maybe we could help be more mindful of working with, men if they're feeling shamed because they're not leading up to this macho, powerful, stereotype that they're being labeled, and women for being, looked upon as, well, you're not fulfilling your roles. You're not being a good caretaker. You're not being a good mother. So some things to kind of keep in mind, and knowing who's more susceptible to addiction or who's more susceptible to violence too will help you when you're working with people. That is it for this part of the lecture video. And in the second part of this lecture video, we will talk about the differences with sexual orientation. So stay tuned.